Okay, I'll request those in the hall to be seated so we can start this session. So this is the session of Figo, and we have 3 speakers. The first speaker is, please slide project kare, Dr. Jean KG. So our first speaker, we are very honored to have Professor Jean Conroy with us. She is the president of Figo, and she is also the past president of American College of Obstetricians and Gynecologists, and also president of EHLF. She has many laurels, and she's been waiting to join the session, so we will first hear her talk. Please, can you put on Dr. Jean online, Professor Jean? Welcome, welcome, Jean. It's good to see you. Sorry to have kept you waiting.
That's okay. I appreciate being here so much. And I think you have my talk.
Yes.
Perfect. Great. So I wish I was there in person with everybody, but thank you very much.
Thank you.
Oops. Very important conference. I know the focus is on COVID-19, but I'm going to give a little bit broader perspective and provide the Figo view of our strategic plan, and then highlight where, in a sense, we took advantage of COVID-19, the virtual world, and produced our webinars. So as the introducer said, I'm president of Figo, Jean Conroy, and I wanted to present our Figo strategic plan to you today. I have no conflicts of interest to do. And I want to commend you for your leadership here in Pakistan. You have wonderful physicians working on behalf of the women, certainly of Pakistan, but more importantly of the world. So thank you to all. My goals are pretty straightforward. I want you to view all of yourselves as leaders, because you are the ones who are carrying an important message to our patients, to our colleagues, and really around the world. I want to outline our strategic plan and help you understand why it's so important to put one in place. I'm going to ask you to help us achieve our goals and our commitments, and then help us grow our foundation of education, advocacy, research, implementation, and capacity building. I want to first review the Figo. I call it our pentad. We have headquarters staff, we have trustees and council, our divisions and our committees, and then ECAC, which is the Education, Communication, and Advocacy Consortium. Member societies and first, let's look at our Figo Secretariat, if you will. Our Dr. Marianne Lumsden is the CEO of Figo, but we have a whole host of individuals in our Figo London headquarters who oversee communication, projects, our financial commitments, and our overall conduct. They coordinate the work that we do, and without them, we would not be able to operate. They do a phenomenal amount of work on our behalf. Second, in terms of governance, we have Figo Trustees. Now, there are 5 officer trustees, president, vice president, president-elect, secretary, and treasurer were elected to office. But this year, we have regional trustees who represent the 5 regions of the world, and it has been a phenomenal asset having them added to the trustee position. We have governance with council. There are 24 elected individuals who represent member societies. And I always say it's very bidirectional, because we hear from them, they hear from us. And most importantly, those members, once they rotate off, as you've seen, we have new council members. We've got our continuing council members and new council members. But once these members rotate off, they continue to amplify the message, because they know Figo better than anybody and can amplify the work that we've done. So I keep saying that our influence and our members keep growing. But I said I'd focus on our Figo strategic plan with you. It took a year and a half to develop, and it is meant to carry us through for the next decade. So it's not something that every 2 years when you get a new president, we want a new plan. That's not our goal. Our goal was to take in our committee chairs, our trustees, our council members, representative from all of them, and put together a plan that would carry us through the next decade. Our vision is that women of the world achieve the highest possible standards of physical, mental, reproductive, and sexual health and well-being across their lifespan, throughout their lives. I would say it was a unanimous opinion from the trustees, from the council, from our committee chairs, that we needed to place Dr. Mahmoud Fatallah's words at the very beginning of our strategic plan. Dr. Fatallah was the president of Figo back in 1994 to 1997. In the 1990s, he said, women are not dying because of untreatable diseases. They are dying because societies have yet to make the decision that their lives are worth saving. We've not yet valued women's lives and health highly enough. 1990s, 2 decades ago. And those words could be issued today and mean exactly the same thing. Why have we not? We have 4 pillars within Figo that are based on our knowledge foundation. Knowledge is the essence, but without these 4 pillars, we would not be able to accomplish what we need to do. One is education, like we're doing right here today. Education is critical. The second is research, interpretation, and implementation. How do we take that knowledge, interpret that research, help guide our education and advocacy? It's critical, and we need a strong voice to be able to do that. The third pillar is advocacy. How do we advocate to our member societies, to our region, and, as importantly, to government officials, to ministers of health, to our hospital systems to bring about change? And then finally, how do we build capacity? How do we strengthen the numbers that we have? And how do we have everybody work to the maximum ability that they have? Our mission is that Figo will elevate the status of women and girls' health, reduce disparities in healthcare for women and girls, and advance the science and practice of obstetrics and gynecology through education, global research, advocacy, and capacity building. A very straightforward mission, but an important. And our goals are equally important. We want to improve the health and well-being of women and girls across their life course worldwide. It's that life course discussion that we continue to have. We want to enhance the status of women and girls and families, enabling them to reconcile and to realize the full potential of education, sexual and reproductive health and rights, professional opportunities, and personal well-being. We need to advance the practice of obstetrics and gynecology through education, through training, through research, and advocacy. We can expand the knowledge base and share that through every society around the globe. We employ the highest ethical and professional standards in doing so. And then finally, we need to strengthen the role of Figo in global health. When somebody asks about women's health, Figo should come to mind. We put together what we call 10 commitments. Our commitments are to strengthen and support the regional federations of obstetrics and gynecology. Who knows better the pulse, the needs, the dedication of a region than our regional federations? But we also know we need to strengthen the capacity of national member societies by supporting and empowering them to play a pivotal role in all aspects of healthcare. We need to encourage all efforts to empower women and girls and promote gender equality by maximizing their potential through education, health, and economic strategies. And we need to ensure sexual and reproductive health and rights by supporting the provision of accessible, affordable, sustainable, and comprehensive health services, all health services. We need to empower clinicians as leaders. That means every one of you to view yourself as a leader, whether I'm talking about your hospital, your community, your region, your nation, and the globe. You are leaders. We need to disseminate the current evidence in the field of obstetrics and gynecology, and we need to support the Sustainable Development Goals, particularly numbers 3 and 5. We must stand for universal health coverage. Who better than an OBGYN to discuss universal health coverage? It includes evidence-based preventive services, environmental health, and access to emergency medical, surgical care for women and girls. An OBGYN understands prevention care. Look at us with our mammograms and cervical cancer screening. But we also know the importance of surgical care, whether it's cesarean sections, hysterectomies, or fistulas. We understand the entire range. We need to eliminate cervical cancer. And then finally, we need to reduce global maternal morbidity and mortality. And to achieve these goals, we have created a path to success. And I say it's two complementary tracks. One is on advocacy and policy, and the other is membership and partnership. And if we don't have both of those, we will have failed. So we have to be working. Obviously, I thought it's easiest to explain this with taking goal number 1 and describe policy and advocacy and membership and partnership. And for every one of our Figo goals, we've done the same exercise so that we've pretty well outlined our path to success. So with goal number 1, we want to improve the health and well-being of women and girls across their life course worldwide. Remember, we've got our committees that I'll get into and our divisions that have this focus. Through policy and advocacy, we're going to advocate for universal health coverage. We're going to reduce maternal morbidity and mortality. We're going to accelerate the international development targets, work with governments, our ministers of health to create change, and then provide collaborative efforts. And then finally, make sure that we can find resources. And then with our membership and partnerships, we can strengthen communication. We strengthen the capacities of member societies and our regional federations and collaborate with them. We look for international partners, whether it's World Health Organization or PMNCH. We've got partners around the world. We need to collaborate with data sharing, promote innovations, and then look for learning, virtual learning capabilities. And nowhere has that been more important than what we've seen with our response to COVID, whether it was abortion access through virtual communication, whether it was webinars and teaching, whether it was developing guidelines around a vaccine. We took advantage of our COVID situation and were able to maximize. But I said, we're talking about women's health care across the lifespan. It's our health. And if all we do is plan and don't implement, we won't have accomplished anything. So this is the intersection of planning and implementation. We take our knowledge and then figure out how do we change. Through our membership and partnerships, we are going to use modern technology and communications, encourage collaboration between divisions and committees, create organizational capacity, develop a virtual university and a virtual learning platform, generate enough income to do all of this, support women in leadership, and ensure our financial stability. If you go on our website, just click on divisions and committees. It is a phenomenal summary of what we're doing. We've got 3 divisions, 17 committees, 165 physicians, OBGYNs on these committees, and then another 50 associate members who are contributing and really extending our base of influence. What an incredible amount of work. And this is just an overview of our committee and division structure. Divisions are new for us this year. That was an incredible recommendation from our strategic planning. We said we need to put safe and respectful care. It's not a committee, just have that form the basis of all that we're talking about. And then we have spheres of influence from our committees, the inner sphere, and then all the globes outwards. So in our inner sphere, we have climate change and toxic environmental exposures. We have women facing crises, human rights, refugees, and violence against women, and then the ethical aspects of human reproduction and women's health. We've got divisions of benign surgery with obstetric fistula, minimal access surgery, and urogyne, and then the division of maternal newborn health with health system strengthening, childbirth and PPH, infections, preterm birth, and the impact of pregnancy on long-term health. And then we've got our division of sexual and reproductive health and well-being. There we have crossed the gamut from contraception and abortion to conception and infertility treatment and reproductive endocrinology. So it's that entire range. And then we've got 3 more individual committees: women's cancer, well women healthcare, women's health across the lifespan, and then finally menstrual disorders and related health, impacts. So it's very large, as I said, 17 committees, 165 OBGYNs. And thank you to your very own Dr. Rubina Sohal for being a chair of the Women Facing Crisis Committee. Out of it came increased access and knowledge of how to use telephone.
Jean Conroy, I don't know if you're still there with us live. Is she still
am.
there?
Thank you. I can hear you well.
Okay, it's so good to hear your talk. So if you have any further comments, I don't know where in the world you are right now, because I know you're a great talker. So any particular message for Pakistanis? In my hurry to get you on, I actually forgot to call our chair, which is Professor, our chair of the session, Dr. Shahida Zaidi. I will request her to please come here. And our president, Dr. Razia Kurejo, professor. So, Dr. Idhar baith jaye, Dr. Shahida. So, I'm sure you've met Professor Shahida Zaidi. She is the past vice president of Figo. So I'm sure you know her, Jean. And Professor Razia Kurejo is our... And,
so honored to be here with all of you.
Yes, and our third chair is Professor Azizun Nessa, who is a professor from Aptabad and KPK Aptabad, yes, and Professor Razia Kurejo, who is the president of our society. So would you like, if there are any questions for Dr. Jean, please go ahead. Okay, they're actually, no, we're not allowed to have questions in a plenary, but Jean, would you like to say anything further?
I think my most important comment is about the incredible leadership you have in Pakistan, because the leadership sets the example for all of us. And as we're looking at ways to go about improving the care of women's health, we rely on all of you to accomplish that. Just looking at this conference and all the topics that you are sharing, it's an incredibly robust Congress. So congratulations on that, and congratulations on the leadership you show.
Thank you, Jean. So in the interest of time, we will move on and go to our next speaker, which is Dr. Hema Dewakar, who is the chair of Well Woman Healthcare Committee, Figo. And she will be talking on reshaping pregnancy care with technology. So can we, sorry to
Namaste, everyone. Yeah, my greetings from India, and very special hello to Razia ji, Halima, Sadia, Rubina, and of course the chairs, Shahida Zaidi and Azimunisa. Delighted to be here, and my love to all the 4,500 OBGYNs of the SOGP. Namaskar and thank you. I hope the recording would be moving on now. Yeah, thank you. there.
Namaskar and greetings from India. This is Dr. Hema Dewakar, who's very grateful and thankful to the Pakistan Society of OBGYN for their kind invitation and making me a part of this mega event. Innovative management of pregnancy through digital platforms. That is the topic for deliberation. And the very fact that you and me and the rest of the world is connecting with each other on the digital platform, we are sure at the brink of transformation in every sphere of our lives. So then, coming back to our area of maternity care, it's not only the pregnancy care that in many ways can be handled through the digital platform, but it's also the pre-pregnancy and post-delivery in a wholesome way. So what are we focusing on redesigning the pre-pregnancy care, the adolescent care, the inter-pregnancy care, and many of the essential or emergency obstetric care. Well, we were working on the project of ABCDE since 2 decades, and I must put on record that in the last 2 years, on the very same initiative on anemia, adolescent care, contraception, cancer cervix, diabetes, and emergency and essential obstetric care, there has been a phenomenal scale up of all our activities just because of COVID and opening up of our mindset to the digital connect. When we say the adolescent care, we know that these targets don't reach us, but they very easily reach the digital platforms. So the importance of dealing with issues of anemia, malnutrition, stunted growth in millions of adolescents is because of the impact that this may have with undernutrition, overnutrition, or micronutrient deficiencies, causing not only millions of deaths, but also a tsunami of non-communicable diseases, especially in the Asian continents. So then the test, treat, and talk of anemia, which we embarked on since the last 3 decades, going to every possible nook and corner, to the schools, as you would see, that we are speaking to clusters of young girls to give them the advice on deworming and the right kind of nutrition that they must take, and make sure that they embark into the reproductive age in the pink of health. Certainly, you would see a transformation in this picture where the capacity building for the frontline healthcare workers is happening through the digital connect, taking us closer to the anemia-free situation in our own country. We have seen the needle move ahead, far ahead in the last 2 years or so, because the capacity building, strengthening the supply side, the demand generation, speaking to the young people and almost everybody in the country through the social media and Facebook Live initiatives, we have been able to escalate the awareness and bring them to a place where they would be acknowledging the fact that if they have their anemia status corrected, they are in a much better form and shape to enter the pregnancy. Artist is our organization which plans to transform the future of women's healthcare to digital skill transfer. I was just speaking to you about the capacity building, because women will come to the clinic, girls will come, but what do they get there? A suboptimal care. So when we are progressing towards universal healthcare, it should also be quality driven. So can we do the skill transfer or the training in a robust manner through the digital platform? Relentlessly, we have been working on this, scaling up every single staff nurse and the paramedical workforce, frontline healthcare provider training in every nook and corner of the country. And how could we make this happen? Because more than 1,130 million mobile subscriptions in our own country, which goes to show that adapting the digital platform is indeed the DNA of the generation next. You will see in this picture, which I don't have to explain much to you, whether it's rural or semi-urban or urban India, the generation next, you can quite imagine how they will use the digital platform for many issues in their life. So coming back to the newer technological devices, like a non-invasive hemoglobin check, for example, the optimal weight that a woman should enter the pregnancy, the status of the thyroid established, everything can be taken care of with the newer point-of-care devices, where even the semi-skilled can go home to home, or just like how in the COVID times, everybody used a pulse oximeter, they can use such devices by themselves, and the values will seamlessly be transmitted to the concerned doctor or healthcare provider through the Bluetooth. So many of these are already in place, with lakhs and lakhs of women and children being exposed to the use of these fantastic gadgets. Obesity, yes, in low middle income countries, including India and Pakistan, this is becoming a new era menace. And to sensitize them that today you're obese, but tomorrow you're prone to all of these health risks, that can easily, seamlessly be done through the digital media. This is to create awareness, but from awareness to action is where we need to go. So all of the initiatives translate from the capacity building and training of the healthcare workers to the understanding of the lay people, transforming their journey from illness to wellness. So the video consultation, which was legalized 2 years ago in our country, every nook and corner where they would not have an access to a clinician or a top-end specialist anywhere across the country, now we can really reach the last mile by the video consultations that we offer. Please do not underestimate our wise women and girls in rural parts of the low middle income countries. You can see them chatting in their own language, receiving the messages, conveying the messages, sorting out the myths and misconceptions. So in the diabetes care especially, not only the glucose can be monitored, but the pop-ups can come for the diet advice, etc. So it is well said that the innovations in the diabetes care, in diabetes in pregnancy, the women especially, where there is a lack of dietitian, lack of enough number of diabetologists, everything can go through the digital platform. It's indeed not the new insulin, but the new devices which will help us take better care. So the future is bright because technology is transforming women's healthcare. The time is here and now for us to plan our campaigns, to create awareness, to generate engagement, compel them to move towards wellness, encourage action, and sustain this momentum, because you can see how digital technology is changing every phase of life, and this would be a common scenario in the generation next. So there are many new devices which would be available to us to establish a hybrid clinic. Yes, the touch and feel is important. Few visits, they may need to come to the hospital, but instead of 10 visits, maybe only 2 visits. And many things can be taken care of in the back end, inclusive of prediction and prevention, and the higher end tests which can be done by the new technology, the instruments, especially the non-invasive ones, which anybody and everybody could be taught to use. So the training is an important component, change of mindset is another, and teleconsult from any nook and corner. Yes, there would be challenges. Digital innovations in the maternal and newborn health are scaling, and the drivers to adopting the digital technology, both the doctors, healthcare providers, and our peer group should have their minds open and believe in the fact that this hybrid version will go a long way in changing the ecosystem and the face of the healthcare for girls and women in countries like ours. We leverage on the existing platforms. The tech requirement is really rudimentary. Interoperability is possible, whether it's a laptop or a mobile phone or an IVR system or the social media. Anything and everything can come to our rescue, and you will see a number of connected devices for the pregnancy care, right from blood sugar to hemoglobin to digital blood pressure, the nutrition and the BMI, height, weight, etc., transmitted from the weight scale directly through the Bluetooth, the mobile device, the thyroid, and the pregnancy education to empower them, to keep them on the alert of what they should look out for, and training, because they need the connect of the healthcare providers who are empowered, competent, and confident to offer the care when many millions of girls and women reach them. So our flagship initiative And within our parent organization, POXI, is called the Manyata, and we are very eager to share this experience with Pakistan, Nepal, Sri Lanka, Bangladesh, and other low-income countries to scale and do more and do better. So the small device which you would see here, which would check the cardiotopography or the heartbeat tracing in high-risk pregnancies, can even be rented out to the pregnant women during last 4 weeks of pregnancy. They find it very, very user-friendly, and the NST can be done from home, and you will receive the reports on your you'll receive the tracings on your mobile, and you can guide the patient if she needs to quickly come to the checkup and action needs to be taken, or reassure her that all is well. So the same ABCD initiatives which we started long ago have really taken a very different shape and started making the much needed impact. You will see several snapshots of our training programs and the programs with the lay public as well, in keeping with the SDG Goal 3, good health and well-being for all. Well, this is progressing from dream to reality with the use of digital health, health gadgets, mobile health, and the various newer innovative devices. The advocacy through the digital platform, the training through the digital platform, the research and surveys and implementation initiatives through the digital methodology. It requires many, many players. The technology and the healthcare have to marry each other to connect the dots and squares and circles. Access to healthcare should never be an issue henceforth, and everybody has a role to play to make this happen. And I would end by saying, if it's important to you, you will find a way. If not, you'll always find an excuse. With that, once again, thanking the organizers for this wonderful opportunity, and let's connect again virtually, digitally, and seamlessly. Namaste.
Jean, it was a wonderful talk, and hearing about Manyata, we really need to do this in Pakistan. So thank you very much. You were able to join us without a visa. So this is the thing about COVID, that we are able to go to India and all over the world without needing a visa. Sitting at. Thank you so
Thank you
much.
so much. It's been a sheer delight. Thank you.
I will thank you for joining and waiting so long. We apologize. I will now, our next speaker was Dr. James Leslie Reagan, OBE, DBE rather. She's unable to join us, but I'll introduce her anyway. Most of us who are fellows of the Royal College know her. She's currently the Secretary General of Figo and Professor and Head of Department of Obs and Gynae at the Imperial College London, and Deputy Head of the Division of Surgery, Oncology, Reproductive Biology. And and she was the last president of the Royal College of Obstetricians and Gynecologists. Unfortunately, she has been unable to log in. We will have a session with her after the conference, and you all can join that session remotely. I will now ask our chairperson, Dr. Shahida Zaidi, past Vice President of Figo, to conclude this session.
Okay. Thank you, Sadia. Now, we have had the pleasure of listening to two eminent speakers. We had first Jean Conray, who spoke about the structure of Figo and their strategic plan, which is not a short-term plan, it's a long-term plan. And she explained it very, very, very well. And incidentally, Jean Conray is only the second woman president of Figo in more than 70 years of its existence. And the first time that we had a woman president was in 2005 to 8, when when Dorothy Shaw from Canada was my president while I was the vice president, the only time the president and the vice president were both women. So it's been great to listen to her. And thank you, Hema, from India, who explained to us the applications of technology to pregnancy. And this is almost critical now as the practice of the obstetrics becomes more and more complex and is made easier, hopefully, optimistically, by the application of technology to pregnancy. Thank you very much. Thank you very much, the speakers, the chairpersons, my chairpersons, co-chairpersons, and all of you for being here. Thank you very much.
Thank you, Dr. Shaida. I will request Professor Azizunnisa to say a few words. In the interest of time, we have to be brief. And then Professor Razia Kurejo.
Thanks to my chairs and co-chairs here on the stage. Many thanks to our international speaker for excellent talk. And I would like to take this opportunity to congratulate organizers of this great activity. Professor Razia Kurejo, Professor Arima Yasmin, Professor Sadia Paul, and their team for arranging an excellent activity after such a long time of COVID. And we are all enjoying it a lot. And I feel honored to be part of this great activity. And thanks to all the audience for careful and patient listening. Thank you.
Bismillahirrahmanirrahim. First of all, I would like, on behalf of SOGP, I would like to thank all the eminent speakers for their very informative, prescribed, very informative talk on these topics on the COVID-19 and the maternal. So I'm very thankful to all of you. You know, the SOGP believes in collaboration with the other national, international organizations to work together, to exchange their ideas, and in this way, we can improve our maternal health and neonatal health. So thank you so much, all of you. You are being here, and I am thankful to Dr. Shaida Zaidi for her kindness to chair this session. We are proud of that. Dr. Shaida is
An honor.
Dr. Shaida is well-known personality internationally, and in Pakistan, she is the past General Secretary of the SOGP. We have a close relationship with Dr. Shaida. So Dr. Shaida Zaidi is the renowned person nationally and internationally. She was the president of AOFOG. She was the vice president of the Figo. And so we are honored that Dr. Shaida Zaidi is with us.
Thank you. Thank you.
Thank you. We have to start the next session, and I apologize. There were some questions from the audience, and I was reminded by Dr. Shahida that plenaries don't have any questions. Thank you. Oh, we're going to have the shields now.